This presentation is adapted from Sleep Academy, an online CME-accredited course for advanced practitioners and physicians. My name is Dr. Peter Sloan, and I'd like to introduce Dr. Brian Bonner.
Although our circadian rhythm is a well-established system that literally works like a clock, there are significant disorders that can develop when the rhythm becomes misaligned. And that misalignment can be night misaligned from day, or it could be our own intended school or work schedule that is misaligned with our own internal schedule. Also, it could be our new time zone or our new work environment that is misaligned with our own intrinsic circadian rhythm. So our biologic clock, it's located in the hypothalamus. It is receiving input from the eyes, passing it through the retinohypothalamic tract, and this input is delivered to the clock itself, which is located in the suprachiasmatic nucleus. Actually, it's two very small nuclei, to be more specific, located within the hypothalamus. Based on the input of darkness versus suppression of that from light, the signals are sent to the pineal gland to secrete melatonin. And this will prepare us for sleep. And also the melatonin is secreted throughout the cerebral spinal fluid, will enter the bloodstream, and enters many of the tissues throughout the body where many of our bodily functions are regulated. So what other bodily functions, you ask, are under the control of the circadian system? Sleep is the one that's most obvious. Also, functions that maintain our alertness, circadian influences that affect when we eat, and also impact on our core body temperature throughout the 24-hour cycle. There's also circadian influences on hormone production, and the levels of melatonin as well as cortisol are influencing the production of further melatonin, and the timing of cortisol levels are affected by melatonin. Metabolism, there is a circadian regulation of glucose regulation and other elements of our metabolism as well. Remember from previous sessions that the circadian rhythm, regulated by melatonin, has a characteristic impact on our level of wakefulness. And so in a two-process model, the circadian elements of wakefulness are also affected by homeostatic influences. But for the purpose of this session, I just want to consider levels that are affected by those things, but to just consider the circadian elements because these are the things that may be affected. And remember that the resulting circadian influence on wakefulness, noted on the y-axis, the percent of maximal wakefulness being 100%, and the x-axis being the time of the day, that the resulting influence from the overall impact, primarily from the circadian element, are that we will have a lull of wakefulness in the afternoon, followed by a rebound, and then a nadir of wakefulness, which ideally matches up with our period of sleep in the hours between 10 p.m. and 6 a.m. So just to remind you that the circadian alerting signal is offset by the homeostatic signal that is regulated by the amount of sleep that we've had. So a downward trend in wakefulness if we have not slept, and this is also restored then with sleep onset to improve our homeostatic drive. And the two-process model then will result in the blue curve that we will use moving forward with the rest of our discussions. So let's just not consider homeostatic elements for now and consider that we're going to be addressing circadian elements in a patient who is not sleep deprived. And Let's also suppose that that patient is going to fall asleep at 10 p.m. So what will occur is that at the 10 p.m. Sleep onset, that there is a rise in the melatonin level from the previous 2 hours. And the increment of melatonin and the rate of that rise is going to be part of the trigger for sleep onset. As you can see, the peak in that melatonin level will occur sometime around 3 o'clock in the morning or 5 hours after sleep onset. And so one can actually look at the circadian rhythm and timing based on that melatonin peak and identify that the patient's ideal sleep onset 5 hours before that would be tied to a clock time of around 10 p.m. And therefore attempts to sleep before that or after that will be more difficult. There's also a temperature element to this, and that is that the patient will have a drop in core body temperature at the sleep onset and will drop throughout the night and will bottom out around the time the patient awakens. There's also a tie-in with cortisol being very low at the time of sleep onset and then will peak around the patient's wake time. Now, consider that all of these elements are bundled together so that there's going to be a shift in the circadian schedule that all these things need to move in synchrony. So there are some natural barriers that make it not so easy for things to move in synchrony. And this is, first of all, the need to identify that the biologic clock in all of this is actually 24.2 hours and that the Earth's rotation is 24 hours. So there's not a perfect match between our clock and the natural clock. And so our environment is not always going to match up with our own wake-sleep cycle as a result of this. So if we live in a cave, we would, without any external cues, most of us would be going to sleep 10 minutes later every night, perhaps an hour later every week, yet maintaining a total sleep time and awakening later to a similar amount of time in total of wake and sleep. So we depend on cues in the environment. The term Zeitgebers, German word meaning time giver, refers to these cues that help us match up with that 24-hour cycle. And daylight is the most important Zeitgeber to entrain us to make that 24 hours match up every day with the Earth's rotation and to put us on a 24-hour schedule that is going to be more consistent. So let's take another look at the synchrony of the things that are occurring in this patient who falls asleep at 10 o'clock. There has to be this increase in melatonin. The core body temperature has to be at its high, after which there will be a drop throughout the night. The cortisol level has to be at a low. And the melatonin peak is 5 hours in the future. So with all of these things together, this is supporting the circadian drive to fall asleep at 10 p.m. This certainly is one way to appreciate why recommendations in terms of sleep hygiene are to have a regular sleep-wake cycle and to have a regular time to initiate sleep. Now let's take a look at some of the variations in this that can lead to a disorder.
If you'd like to learn more, please visit our educational center at pulmonaryandSleepAcademy.com, where we have 70 hours of self-paced online CME-accredited courses covering pulmonary, sleep, cardiology, and critical care medicine. Please enjoy more of our short visits on our PSA YouTube channel. You can purchase our full courses with an exclusive 10% discount code using YouTube10.